Hello. Can you all hear me?
Yep, I can hear you.
Oh, good. Hi, Robert. Little bit of technical difficulty tonight. I'm very sorry. Let's see if we are on the camera webcams. Can you guys see each other? Are you up in the meeting? Ah, there's Robert. Okay.
Oh, I can see Robert.
Yeah, I think I see myself on the screen. That's
Okay.
it.
Webcams. Let's see. Hide, share. Okay. We got two. Is Paula here with us? I see her. But she's self-muted. So Paula, I think you're here. So it looks like
here we go.
Hi,
Can
Paula.
you guys? Hi, how are you?
Good. Okay, so whenever you're ready.
Can't hear Brian.
Yeah, no, I was muted. All right, it's 6:01 and all the board is here. So call the meeting to order.
I second it.
We'll do a roll call. Why not? I'm Brian Green.
Paula.
Robert, yeah.
Oh, sorry.
Oh, go ahead, Paula. Sorry, I butt in.
That's all right. Paula Machado.
I have a copy of the agenda. The approval of the September minutes. Make a motion to approve.
Second it.
All in favor?
Aye.
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 Okay. COVID updates for something new and different.
Okay, I'll keep the COVID updates brief. You know, the numbers have fluctuated up and down. I think we've seen that. And there are, you know, at this point, there are no major changes. We continue to push out the test kits that are free in our public libraries, city buildings, getting the messaging out. There was a message from Governor Baker's office this weekend, over the weekend, asking that people be vigilant about the flu season, COVID season, winter, as we all go inside. And so we've tried to push that message out as well through the city's website, Facebook, all of its channels. We are now offering clinics. So we are doing some COVID booster clinics here on site, and then some throughout the community, again, in targeted areas. So we'll give you the rundown and the summary of clinics in our minutes and our updates. They're going well. We're seeing a bit more demand. We are about to do a regional clinic in a few weeks with Tufts and Medford. So that's exciting, and just trying to work through logistics on that one. Again, you know, with our limited staff and capacity, we can't do as many clinics as we'd like, but we are trying hard to partner with CHA, Cambridge Health Alliance, this fall, which has been fantastic. They are bringing say, COVID booster, I think, to most of our clinics, and then we do the flu, so that both are available at these clinics when possible. I don't know that they've come to all of our clinics, but they've certainly come to some, and that makes a huge difference. They also have language capacity, which is great at the clinics. And I'm told that last Saturday's clinic, they actually were able to enroll a few individuals who came to the clinic for their vaccines, also were able to enroll in health insurance and CHA, so in a medical home. So this is great. This is the kind of thing we want to build on. So, you know, other than that, I don't have any major updates. We continue to meet bi-weekly with the Somerset team here and other folks from the city to talk about communications, talk about strategies, talk about any trends we see that are concerning. So unless there's questions, you know, COVID keeps on coming.
I don't have questions about COVID keeping on coming. I think the vaccine clinics are great. I'll say parenthetically for people who are curious that I got my COVID bivalent and flu in my left arm today.
Okay.
VA policy is that we all need the flu shot by the 31st. And I got the monovalent just about 3 months ago. So due for those things. And no worse for wear so far. So you can get them on the same day, and there's good reason to be getting them both right now, because right now we're seeing flu coming. We're seeing COVID's around, hasn't gone away.
Yeah, Brian, I'll echo personal policy to always be updated on my vaccines. And yes, I also got the double dose a couple of weeks ago, and a little sore, a little groggy, but it's good to have some peace of mind going into, this time of year. So yeah, totally endorse and support that messaging.
Great.
Makes Thanksgiving easier to handle, which is coming soon. Not to mention Halloween, which is important. I'm all for everybody getting out and about outdoors. Okay, I don't have anything else to say about COVID. Health and Human Services Department updates?
Great. I will share with you some documents that will make this a little easier, so I don't have to go into great detail. But I think I talked with you earlier in the fall about producing an organizational chart, which has involved a little bit of a departmental reorganization, I call it, that based on new positions that were funded in the department at budget time that were asked for before I arrived. But myself and Nancy Bocci, the deputy director, have been working very hard with our HR department to get our structure in place, figure out who's reporting to who, keep those lines clear and logical, and getting those positions recruited and hired. So I'm happy to say that we have filled about half of them, of the 8 new positions. We have 4 and about to be 6 hired. And I'll show you on the org chart so you can see where they all fit. But the positions that we have trouble hiring are social workers. That's nothing new. And so Nancy's working hard on that. But we have been able to fill our position. The first big position is the Deputy Director of Public Health for the department that was funded this year for the first time. And I'm happy to announce that Kelly Highland, a nurse with a strong public health and social justice background, joined the team this week. And I will ask her to come along to our next board meeting so you can meet her, ask her questions. She's jumped right in, working with our nursing team and our community partners around COVID, flu, and the time of year we're in right now. But she'll be doing a lot of work on prevention and all of the other projects in the department. So thrilled to have Kelly join us. We also hired a shared service coordinator for our regional grant who started this week. We have hired a veterans project officer, soon to hire a benefits director as well. And Nancy's been very busy with developing the youth director position, youth services director, and the LGBTQ+ coordinator. So lots of new positions here in the department, and we're making some really good progress at getting our department staffed up, which is the first thing. So happy about that. The second part of the year, so I will also send you a document of some goals. We've been working with our Somerset department to develop individual and then departmental goals. And they're very much in a draft format because we're sort of all working individually, and Somerset is going to help us pull them together, as well as add our budget goals that were talked about at budget time. So they're going to bring those in and help us measure. But that's been an interesting process, and I think we have some more work to do to kind of refine those goals. And we're really thinking 6 months at a time. We're kind of looking at where are we right now in these first 6 months. My goals have been around hiring, filling positions, securing resources, and beginning to build a team. So professional development, opportunities to collaborate as a larger department, and then with our outside agencies. In the second part of the year, and we are pleased that just recently last week, CHA announced or released the first, well, I think it's the official draft or version of their needs assessment has come out. So there's a lot of good data in there that we're going to be plowing through as a department, and is setting some more goals. I think for the second part of this year will be goals around what we see in the needs assessment, and how maybe we think that should start to tweak and change our program planning, or where we're going as a department. So that's kind of some of the big picture work that the team has been doing. There is an opportunity to both start planning for budget requests for next year, as well as mid-year appropriations if there is anything urgent. So we're taking a look at those things as well as a division, if we have any urgent concerns, as well as grant opportunities and ARPA funding that's coming up. So speaking of ARPA funding, we have made significant progress with our partner agency, or with our community partner, Somerville Homeless Coalition, on their community engagement center. So that is something that they asked for ARPA support from the city a while back, and were given sort of support in principle for the project, but then there were a lot of details to work out around the where, the how, and we're thrilled that they have found a lease for their offices. So they're working through a potential move of some of their office spaces to accommodate space for their patrons, their clients, to be able to come in during the day in extreme weather, and there'll be a range of services provided there. So I'm really happy to be working with them, a fantastic organization, and they are a huge help to us as issues come up in the community, for DPW, for our team, helping us to resolve issues and get people the resources they need. So we'll keep you updated on that, but that has definitely taken a big step forward, and we're hoping by this winter there'll be some semblance of the first steps of a community engagement center here in Somerville for people to take advantage of and get out of the elements. So that is great. And then of course the supervised consumption site is an ongoing project that HHS is continuing to support the administration and the community on looking into what the different sites listed in the feasibility study. And right now we're working with individual city departments around the logistics for these sites, these potential sites. So as you can imagine, that's a lot of detail for things like engineers, DPW, parking. So that process is underway, but we're really pleased with that, the way that's moving along as well. I think those are the main things. The only other thing that I wanted to bring up at the request of the mayor's office and the administration is that they are embarking on a process of looking at all boards and commissions in the city. Not sure if this has come up before, if anyone's spoken with the Board of Health in particular, but they asked me to just loop you in and first of all say they want to thank you, and they recognize the hard work that this group has done. This is in no way a reflection of the board members and wanting a change or wanting anyone to go away or any of that, or the work you've done. But they have recognized, not unlike many other departments, we are out of term. We are out of compliance with our own bylaws. So the bylaws say that there are certain terms for, and they should be staggered, so everyone doesn't leave at once, and so there's a lot of logistics to work out with when you have multiple boards and commissions, where, like in our case, I think all 3 of your terms have expired. So We do not want a mass exodus. And so we want to be thoughtful and planful about how we get you into compliance with the terms of the bylaws. So, which doesn't necessarily mean you have to not be on the Board of Health either. You just either need to get renewed if that's your interest, or there's all kinds of processes involved here. So what they asked me to do is reach out to each of you individually. So I'll give you a call individually to see what your questions, concerns, and interest is in terms of your expired term on the Board of Health, and your thoughts about maybe how we can proceed with the staggering of this process. And I don't have a firm date that the city's looking to do this, but they are, there is a group or office that has been tasked with trying to get all of the boards of commissions in compliance. So just giving you the heads up. And again, for this 4 months I've worked with you guys, you're fantastic. And the city is very lucky, and the residents, to have such a dedicated board. And I will, like I said, reach out to gauge your level of interest in the process moving forward. So any questions for me? Not that I'll know the answers, but can try or take it back. Yeah. Okay. Thanks. And that's it for updates for me. There's a million things going on, but I don't need to tell you everything. But please reach out if there's anything specifically that you're wondering about.
Yeah, Karen, on the appointments, makes total sense. I mean, it's kind of natural for it to happen, especially since the last 2 years have been, a little busy. So, some of these things fall on the wayside. So yeah, happy to chat. Probably be a good idea to chat, and we can discuss logistics and all this. And yeah,
Great.
Happy to support that. Just on your HHS updates, as you know, like I'm always interested in the health needs assessments. Anything kind of illuminating that came out of the initial draft from CHA? Any trends, insights that you might be worthwhile to bring up, or still kind of in like the initial state and need some review?
I'll send you the link. To be honest, I have not spent a lot of time. It just came out maybe earlier this week, end of last week.
Yeah.
So I haven't gone through all of the data or really much of it in any detail. We did have an initial call with them where they talked through some of the general themes and the process, how they went about the process. And certainly for parts of the process where they involve the community and stakeholders, I don't think there's any big surprises there. Was definitely increases in concerns around mental health. Social determinants of health are flagged, and then in the actual admission data and whatnot, again, I haven't looked at that in any great specificity to be able to comment. But we do have, as part of the role of our shared coordinator, who I mentioned in the beginning, she started on Monday as well. And fortunately for us, she's only working now across 2 towns, Arlington and ourselves. And one of the initial things that we would like her to do is help look at the needs, look at 2 things. Our capacity to meet all of the core public health functions and regulations of Mass General Law. And then some of these
And just a quick question on that point. I did get an email on the capacity. Should I also be responding to that as well? I should. Okay.
If you can, they want board members, any staff who work on either health inspection. So we sent it to ISD, anyone who contracts for the health department, Health and Human Services. So if you have a minute, it's not a long survey, but there are a few questions that are a bit strange. And the only thing to note is that we are part of MAPC Somerville. That's just the name of our shared service public excellence grant. MAPC is the TA, but yeah, so it kind of looks like when they ask what city are you with or what excellence grant are you with, that's what you would check, the MAPC.
And can you give me that again? Which one is it?
I forget which number it is, but I think you'll see it. It asks you to say which one you're part of. It's the only one that says Somerville. So,
all right. Fair enough.
Yeah, and if you're not sure, you can leave that blank. I think it's important, or just put it in the notes somewhere. They will be happy to hear from anyone that's part of the workforce of the health department. So thank you. Yeah.
Okay. And just another kind of thing I'm just interested in, and this was a really big initiative, started with COVID and really only culminated or kind of finished earlier this spring, right before your term, started. And it was the eviction moratorium that we started initially, and then just had been sort of extended, multiple times up until I think April of this year. And, obviously a lot of interest, a lot of passion, a lot of voices in that matter. So, now we're, about 6 months out, and obviously going into, I think, what's been, I think, a gradually difficult time for people with affordability, housing, winter. So I think, a follow-up would be kind of interesting to hear. Brian, do you remember who we were working with in the city? I forgot. We had someone who was kind of like in the housing support team. I forget her name.
Was it Ellen Schachter?
Yes, it was Ellen.
Ellen, the director, yeah?
Yeah, she was fantastic.
Yes, she is.
This is certainly not I'd say like a priority, but certainly something
Yep.
I'd be interested to know, like, how the city's looking, post eviction moratorium. She provided some great, like quantitative measures on, during the eviction, evictions that went to court, evictions that, they were able to assist, evictions that, some of the state agencies were able to prevent. Just would love to hear the posts on this now that we're in this different state. So, yeah.
Great. I will ask her if she'd either be available to come and talk with you guys next time or to send some kind of a.
Yeah, November, December. Yeah.
Yep.
But
Great.
I'd be interested in getting an update there.
Sure.
Thank you, Karen.
Mm-hmm.
That's all I have.
While we're on the topic of follow-up things that sparked curiosity, I was been attending the internal medicine continuing medical education course this week, and there was one about tobacco cessation, and there was this whole legislative thing about all of the work that was done about regulating vaping and flavored cigarettes and flavored vaping products, and no mention of Somerville, although it was all stuff that we were really instrumental in doing. But one of the things that I found interesting was that the national legislation that eliminated the flavored vaping products for recurrent use had a loophole in it that allowed disposable flavored vapes to be the thing that came through. And so apparently there's a huge spike in sales of those nationally. And I didn't think that was an issue in Somerville because I thought we said all flavored tobacco products. So
Right.
this is like one of those moments where this is actually a national thing that is not a Somerville thing. But I just wanted to verify that was true. That the one-time use flavored products is not a thing that we are selling in Somerville.
I will double check with Bonnie. I think you're correct in that our regs go beyond the state and cover for all flavored tobacco products, including, I think we kind of spell out the tobacco control program here in the state gives us these templates that cover off on most of everything. Having said that, you've seen the tobacco industry at work, and they will continue to find these new and innovative ways to introduce products that, are targeted to people to keep smoking. So,
right. And again, the flavored products, for people who weren't part of this discussion all along, with the thing about flavored products is they're intentionally targeted at kids. When you're making things apple cinnamon flavored, it's not because you want the
bubble gum and
bubble gum. It's not really designed for older people. It's designed for getting high school kids to use them, which is in fact what it did do.
Yep.
The data and Jewel, how much their market share was teenagers versus adults was jaw-dropping, but expected.
Yep. Mango flavor, I know. Yep. So I will check on that with Bonnie, and Bonnie and I are attending the MHOA conference on the Cape, the annual conference that DPH does for health departments. And there's always a tobacco track. So Bonnie will be going this year as well. And, you know, we'll get up to date on all of the latest trends and what's happening there. But I will check with her. It's a good question.
Paul, anything on your agenda?
No, sorry, I'm so quiet. I can't really, don't have much to add. I
Okay.
am due for my, though.
In terms of the board thing, the only thing I would say is that I think all of us have been on this particular board long enough that we've been down this road before. It's not the first time that the city has had a hard time keeping up with the appointments.
Interesting, yeah.
Agree with-
All right. Well, there's not anything else on the agenda other than the next meeting on November 17th. Next meeting, November 17th.
What was that?
Let me confirm I can do that day. I feel like I can. Just let me bring up a work calendar. I might have something, hopefully not. So just give me one moment.
Mhm.
Yeah, I can do that. Okay. Yeah, I'm still on board for the 17th.
Great. And I will speak with Ellen to see if maybe she could come along then, or the December meeting and give us an update. I think that would be great.
Great.
Oh, Karen, I always volunteer. If the city needs help with like the flu clinics or anything, let me know. I'd be happy to help.
Thank you, Paula. I know that one thing that we are looking for help, and just this is also for you to know about as the board, our Veterans Department under Ted has organized for the Moving Wall exhibit, which is a national exhibit for veterans, and it's a memorial wall, if you like it, but it's able to be moved, disassembled, and brought from community to community. It's been traveling throughout the United States for some time. I don't know its exact schedule, but it will be coming here to Somerville this month, and it will be set up in early November for the Veterans Day weekend time period. It will be here, I think, for at least a week, and Ted, and there'll be, you know, a spot for visitors and refreshments and things like that. So Ted has been looking for volunteers to help with the Moving Wall project, and it will be over at the MGB Gardens in Assembly Squares where it will be located. So, and MGB has been really helpful in providing whatever is needed, lights and support in the space, but we will need some volunteers. So if you're interested in that, you can reach out to Ted, or you can ask me and I'll connect you to him. And I will let you know about the clinics too, Paula. Thank you.
Yeah, no problem.
All right. Well, 6:29. I guess we can close the meeting.
All right, second it. Have a good night, guys.
Thank you, everybody. Have a good night.
You too. Thanks.
Well,
Bye.
Bye.
Let's